So often us runners are told that we have tight hip flexors and we need to work on stretching those hip flexors. But what if there's something else going on? Let's take a look. So it's important to appreciate that a lot of what we hear in terms of tightness around those hip flexors isn't just about the fact that we're sat down all day at our desks and sitting in this shortened position for those hip flexors. Sure, that may well be part of the big picture, but the tightness can often come from weakness, just like any other muscle. A weak muscle, part of its protective mechanism is to become tight. So there's a test we can do to test whether you're weak through those hip flexors, particularly psoas. So we're looking for a step, well, not a step, but a chair or a box, which is around about knee height, or at least the height where if you put your foot on the box, it brings your knee to hip height. In this position, with your foot up, what you should be able to do, unless you have weak hip flexors, is to be able to stay nice and tall, stay nice and upright, and without leaning back, you should be able to lift that foot up off the box clear by a few inches. And you should be able to hold that for 30 seconds without having to compensate elsewhere. A lot of the time, sort of compensation we see is people leaning back to try and lift that foot off the box, or hitching the hips up, and I'll show you from this side. Okay, so not just the leaning back, but it's also the frontal plane, the side-to-side plane that people bail out in. So from this position, lifting the foot off the box. If they're weak through their hip flexors, you won't be able to stay square on. You'll end up seeing a degree of hitching like this. Now, also, try and feel for where you're feeling this movement, where you're feeling the effort in this movement. You should feel deep in the kind of lower abdomen. You're having to work hard. Those hip flexors are working to lift the foot up. If you're feeling that instead around the outside of the hip, it might be that you're starting to overcompensate using muscles like tensor fasciae lata, TFL. Now, if that's what you're feeling, and you're a runner who has a history of ITB syndrome, then that may well be no coincidence. It may well be that you have a tendency to overuse TFL, tensor fasciae lata, here, which blends into the iliotibial band, creates more tension in the ITB, because of tightness through or weakness rather, through your psoas muscles, your hip flexors. So it's important to consider the fact that it's not just glute strengthening we need to do, not just hip mobility work we need to do, but also strengthening work through psoas. Now, this in itself is a strengthening exercise. And of course, if people are weak, they may not even be able to lift their foot off the box in this position without compensating. But there is also another hip flexor strengthening exercise, which I suggest you take a look at. It's right over here. I'll link it up so you can go and give that a go, and over time get stronger through those hip flexors and deal with some of that residual tightness. Okay, I'll see you over in that video.